Can you increase penis size without surgery? This is one of the most searched questions related to male sexual health on the internet. Every day, millions of men look for ways to increase penile size naturally. You will find hundreds of websites promising miraculous solutions, pills, supplements, exercises, stretching devices, creams, and many other products that claim to increase penis length or thickness. But how much of this is actually true? Is it really possible to increase penis size without surgery? Or are most of these methods simply myths designed to sell products? In this video, we are going to analyze the science behind penile anatomy, erection physiology, and the different methods that are often promoted as natural ways to increase penis size. Hello everyone, my name is Dr. Cesar Noval. I am a plastic surgeon and medical director of Clinic NF, specialized in penile enlargement surgery, gender affirmation surgery, and male sexual health. On this channel, we talk about male anatomy, erections, testosterone, sexual health, masturbation, and many of the myths surrounding the male body. My goal is to provide clear medical explanations so men can better understand their bodies and make informed decisions about their health. So let's start with the fundamental question. Is it possible to increase penis size without surgery? To answer this question, we first need to understand the anatomy of the penis. The penis is composed mainly of three cylindrical structures. Two of them are called the corpora cavernosa, and they are responsible for erections. The third structure is the corpus spongiosum, which surrounds the urethra and forms the glans. Inside the corpora cavernosa, there is a network of vascular spaces that fill with blood during an erection. When blood flow increases, these structures expand and the penis becomes rigid. Surrounding these structures, there are layers of connective tissue called fascia, which help maintain the shape and structural integrity of the penis. The most important of these layers is the tunica albuginea, a very strong fibrous structure that limits the maximum expansion of the erectile tissue. This is important because the tunica albuginea determines the maximum size that the penis can reach during erection. Once the penis has completed its development during puberty, its anatomical dimensions are essentially established. So from a structural perspective, the penis does not continue to grow naturally in adulthood. However, there are several factors that can influence how the penis appears. For example, body fat can play a very important role. In overweight men, the fat located above the penis, in the suprapubic area, can partially cover the penile shaft. This means that part of the penis becomes hidden under the fat pad. When a man loses weight, this fat decreases and more of the penile shaft becomes visible. This can create the impression that the penis has increased in size even though the anatomical structure has not changed. Another important factor is erectile quality. A strong erection allows the penis to reach its maximum potential size. If erections are weak due to poor blood circulation, stress, hormonal problems, or lifestyle factors, the penis may not reach its full expansion. Improving cardiovascular health, exercise, sleep, and hormonal balance can improve erectile function and therefore make erections appear fuller and stronger. This does not increase the anatomical length of the penis, but it can improve its functional size during erection. Now let's talk about the most common methods that claim to increase penis size without surgery. One of the most popular approaches is penile exercises. These exercises are often promoted on the internet as techniques that stretch the penis and increase length over time. Some methods involve manual stretching, sometimes called jelqing, or repeated traction movements applied to the penis. However, the scientific evidence supporting these exercises is extremely limited. In some cases, aggressive or repetitive stretching can even cause injury to the penile tissues, leading to problems such as fibrosis or erectile dysfunction. Because of this, most medical professionals do not recommend these exercises as a reliable way to increase penile size. Another commonly promoted method involves penile traction devices. These devices apply gentle, continuous stretching to the penis over long periods of time. Some medical studies suggest that traction devices may produce modest increases in penile length when used consistently for several months. However, the results are usually limited and the devices must be worn for several hours every day over long periods of time. For many patients, this can be uncomfortable and difficult to maintain. Another category of products includes pills, supplements, and herbal treatments that claim to increase penis size. These products often contain vitamins, plant extracts, or substances that claim to increase testosterone or blood flow. While some supplements may improve general health or libido, there is no strong scientific evidence showing that they can permanently increase penis size. Most of these products are marketed without solid clinical research.
In many cases, they simply rely on marketing claims rather than scientific proof. Another group of products includes creams and topical treatments. These products often claim to increase blood circulation or stimulate tissue growth. However, the skin of the penis cannot absorb substances in a way that would permanently change the anatomical size of the erectile structures. As a result, these creams generally do not produce real enlargement.
In recent years, some people have also promoted hormonal treatments as a way to increase penis size. Testosterone therapy is sometimes mistakenly believed to increase penile length. However, testosterone influences penile growth only during puberty. In adult men, testosterone therapy can improve libido and erectile quality if levels are low, but it does not cause structural enlargement of the penis. So if most natural methods do not significantly increase penis size, what actually determines penile size? The main factors are genetics and hormonal development during puberty. Once puberty is complete, the anatomical structure of the penis remains stable throughout adult life. However, improving general health can still have positive effects on sexual performance and erectile quality. Regular exercise, a healthy diet, good sleep, and stress reduction all contribute to better circulation and hormonal balance. These factors can improve erection quality and sexual confidence. In some cases, medical treatments or surgical procedures can modify penile size. Modern penile enlargement procedures focus on techniques that improve length, girth, or both. However, these procedures must be performed by experienced surgeons with a clear understanding of penile anatomy. When discussing penis size, it is also important to address expectations. Many men worry about size even when their penis falls within the normal range. Medical studies have shown that the average erect penis length is typically around 12 to 14 centimeters. This means that many men who believe they have a small penis actually fall within the normal anatomical range. Understanding normal anatomy can help reduce unnecessary anxiety and improve confidence. So let's return to the main question of this video. Can you increase penis size without surgery? The honest medical answer is that most natural methods do not significantly change the anatomical dimensions of the penis in adult men. However, certain lifestyle changes can improve erection quality and overall sexual health. Weight loss, improved cardiovascular fitness, hormonal balance, and psychological well-being can all influence how the penis functions and appears. Understanding the difference between anatomical enlargement and functional improvement is very important. Functional improvements can make erections stronger and more satisfying, even if the actual structure of the penis remains the same. Male sexual health is influenced by many factors, including physical health, hormonal balance, psychological well-being, and relationship dynamics. Approaching these topics with accurate medical information is essential to avoid myths and unrealistic expectations. If you found this video helpful and you want to learn more about male sexual health, penile anatomy, erections, testosterone, and modern surgical techniques, consider subscribing to the channel. My goal with this channel is to provide clear, science-based explanations that help men better understand their bodies and improve their quality of life. Thank you for watching. I'm Dr. Cesar Noval, and I will see you in the next video.